Dancer, it's good to help you as well. Nisigasan Mayangindodam. Good afternoon, everybody. My name is Leona Starr. I work as the Director of Research within the First Nations Health and Social Secretariat of Manitoba.
Hello, everyone. My name is Shravan Ramayanam. I work as Statistical Analyst within First Nations Health and Social Secretariat of Manitoba.
Today, we're here to share our process about sharing information about First Nations based on data linkages and the creation of our own First Nations health profile. Within Manitoba, you can see designated by this red section, we have 63 First Nations that live within this territory. We have several different treaty areas. We have several different nations that also live within the province of Manitoba. We have the Dene, Oji-Cree, Cree, Anishinaabe, and Dakota, and each with their own ways of being, their own ceremonies, their own languages. About 58% of individuals, First Nations individuals, still live in their communities. Others reside either in urban or rural settings. This is something that we've always understood. As Indigenous people, we have always done research. We have always searched for understanding, ways of being, and knowing the world around us in order to thrive. We just didn't call it research. This is a quote directly from one of our chiefs here within our region, Chief Norman Bone of Kisikawanan First Nation. He also sits on our Chief's Task Force on Health that really oversees First Nations health and provides that leadership and advocacy to support First Nations. When we brought together our knowledge keepers for a 2-day workshop surrounding research ethics, this is what they left us with. That research is a relationship that's based on respect, and it takes time to build trust. And it doesn't happen overnight. And how that relationship is so fragile in the beginning, and the importance of strengthening that relationship. Oftentimes, we're left at the sidelines as First Nations people when we hear our stories being told without us, or we hear our stories being told without the context and interpretation of First Nations. We remain hidden in data that really attempts to assimilate or utilizes a pan-Indigenous approach, where it lumps us all in and calls us Indigenous when we are very distinct peoples. Within Canada, we have 3 distinct people that are, we're called the First Nations, Métis, and Inuit people within Canada. And under the term Aboriginal or Indigenous, we're often lumped into an overall group. However, it really does hide the uniqueness and the jurisdictional issues that each of our nations find ourselves living in on a daily basis due to colonialism, due to acts of genocide by the Canadian government. And when oftentimes we see researchers who often try to measure our state of well-being by using an index that measures illness rather than wellness. It measures death rather than life. And ultimately, often data that exists really measures the assimilation of First Nations people into the Canadian construct, which is not who we're trying to be as First Nations people, as Nehewak, as where I originate from. We have our own distinct identities that need to be celebrated and recognized within the data that we collect. And we need to actually have the spaces to be able to speak to that data and share our stories according to our own worldview and lens. Within Manitoba, First Nations leadership have always recognized the need to be able to tell our own stories, to provide that oversight and governance over information. So since the 1990s, they created our own First Nations Research Ethics Board that provides that oversight and governance to information and data that's collected and to research that involves First Nations. So any research that is undertaken with First Nations within our territory, we have a committee that oversees that process to ensure that that research abides by our First Nations principles of OCAP, which includes that First Nations, we have a right to assert ownership, control, access, and possession of our own information. It ensures that we as First Nations have the right to provide free, prior, and informed consent on a collective and individual basis. It ensures that we as First Nations have that our ethical principles are adhered to, and there must be benefit to First Nations. And these criteria are embedded not only within the ANC Constitution. The ANC Assembly of Manitoba Chiefs is a political organization that's represented of 63 First Nations within Manitoba. And these principles have been endorsed by those 63 First Nations.
So to begin the process of data linkage, FINISM has requested Indian status registry file with the data fields you see on the screen, like the first name, last name, date of birth, to name a few. So here is a process that was followed to create the reports. Upon Chief's approval through the resolution passed in 2017, and FINISM and HERC oversight, Indian status registry file was combined with Manitoba Health Registry using first name, last name, date of birth, date of death, if applicable, and First Nations status number to form a key linked file. So this key linked file has the specific information about First Nations. Then this file has been added to scrambled and encrypted personal health information numbers to form a Manitoba First Nations research file with only the First Nations information. And this data file is linkable to other administrative databases. And from there, the results have been analyzed and the desired reports have been produced. And today we'll be looking at the results from the community health profiles, which is one of the reports. At first, a First Nations cohort was formed, which is same across all the reports, and indicators were identified to analyze, and the results were generated at on and off reserve levels, regional health authority, tribal council, and all other Manitobans level, which does not include the First Nations. So let's look at some results now. This slide represents the rates for diabetes by tribal council level and on and off reserve level. As you can see, non-affiliated and island lake communities had highest rates of diabetes compared to others. And in the next graph, you see the off-reserve rates were high in most of the tribal councils. For hypertension, Prairie Mountain Health Region had highest rates. When compared on and off-reserve rates, off-reserve statistics were slightly higher when compared to on-reserve. Looking at the rates for all chronic conditions combined, at tribal council level, island lake communities had highest rates followed by non-affiliated communities, and at regional health authority level, Prairie Mountain had highest rates followed by Interlake Eastern and so on.
So when we identify next steps in terms of really working together to support communities, once we had this analysis completed in partnership with our Manitoba Health partners, we shared each of these community level profiles directly to communities. Once we had identified, the community themselves identified an individual to receive the reports were sent directly to them through two ways. One of them was virtually through a secure virtual link, password protected, called Axway, and through an encrypted USB for those those First Nations who had connectivity issues or not enough bandwidth to actually receive the file electronically. And then, of course, as a research team within our organization, we provided additional support as needed. We're still on this pathway to really continue to support communities through their own ways of telling their own stories, whether that be through information, research, or data. It calls for the need to really establish our own First Nations-led data centers, research centers, based on the development of our own data collection methods, whether that be surveys or through data linkages that really highlight our strengths. And the further development of nation-based indicators of well-being rather than indicators of illness that were commonly measured against, and to really repatriate existing data sets that include First Nations people to really assert that control over those data sets through information sharing agreements, and to really support the creation of our own surveillance initiatives to really inform our planning and preparedness and interventions at the community level. Thank you very much.